Regardless if you are new to investing into biotech stocks, specifically gene editing stocks, or you're a seasoned investor, you may many times wonder, is it too late to invest in these companies? Haven't the stock prices already gone up so far that I'm really late to the party? Well, if this is one of the questions you have been wondering about, I've got good news for you. Because there is in fact a new gene editing company that just recently went IPO with excellent credentials, such as being co-founded by a Nobel Prize winner, no other than Jennifer Doudna. And if just that fact alone doesn't pique your investment interest, stick around and we'll take a deeper dive and a look at Caribou Biosciences. Although I have a PhD in biomedical engineering and over 15 years of working experience in the healthcare industry, I do not intend to give you investment advice. Please consider your own risk profile before making any investments and research your investments wisely. Although the company is newly listed on the Nasdaq, its founders and employees are certainly no novices when it comes to gene editing. The company was founded in 2011, is headquartered in Berkeley, California, and was founded by James Berger, Jennifer Doudna, Martin Jinek, and Rachel Horowitz. So, what is it that Caribou Biosciences do, you ask? Their mission is to develop innovative, transformative therapies for patients with devastating disease through novel genome editing. And innovative their genome editing truly is. They are not just another Cas9 or Cas12 genome editing company, they truly have some proprietary technology. And the scope of their work is to use their proprietary genome editing technology to engineer off-the-shelf immune cell therapies for treatments of cancer. So here specifically, they are working on a pipeline of genome-edited off-the-shelf CAR-T as well as CAR-NK cell therapies for a range of tumor types. So you might ask, why should I care as an investor or as a patient about these allogeneic cells? And what kind of cells are they anyhow? What are they being used for? In the remainder of this video, I'll try to answer these questions for you without going too much into the science, but just enough so that you can understand why they are so unique and to discover why this might be a fabulous investment opportunity. So, let's address the first question. What does allogeneic mean and why is it so important? What are the advantages? In short, if your medical treatment requires to replenish or administer a new type of cell into your body as part of the treatment, you have two options or two choices. You can either take your own cells, modify those in some way, for instance through gene editing, and then reinfuse them at a later stage in order to induce the treatment. Or you can take other foreign cells, basically, not your own, do the same thing. Anytime your own tissues or cells are being used in order to manufacture a type of treatment, we refer to those as autologous cells. In contrast, if cells that are not your own body's tissues or cells are being used to manufacture a treatment, those are allogeneic cells. And with those, there is the risk that your body may reject those because, in fact, your immune system will recognize any cell that is not their own as a foreign, potentially invading cell that needs to be destroyed. So you may ask then, why use allogeneic cells if there's a risk that those are being rejected and ultimately killed by the patient's own immune system? Well, first of all, these allogeneic cells can be modified such a way that the immune system of the patient receiving those, in fact, will not recognize them as foreign and will not try to destroy and kill these. The advantage of using allogeneic cells is that those can be manufactured ahead of time, they can be stored at the hospital and then be used at the time of need. And generally, it's the timing that is the main issue with autologous cells to be used for gene editing or any other similar applications, because cells first have to be harvested from an already sick patient. They then need to be genetically modified, multiplied, stored, transported, and then basically be reinfused into the patient. And all of this takes a lot of critical time when the patient requires immediate treatment. So next, let's address what type of cells Caribou Biosciences are working with for their genetic edits and treatments. First off, they work with T cells, which are a type of lymphocyte, and as such they are part of the immune system. T cells play an important role in the immune system as they can identify foreign invading cells such as viruses, but can also detect cancerous cells and kill them. The other cell type that Caribou Biosciences are working with are natural killer cells, and they are also part of the immune system, able to identify foreign invaders, rapidly killing those, including some cancer cells. However, as you know that cancer is still one of the leading causes of death in the world, you can probably presume correctly that neither the T cells or the natural killer cells are really highly efficient and effective at detecting every type of cancer cell that may start to grow in your body. So, armed with this background knowledge, let's now enter the world of so-called CAR T cells. The prefix CAR stands for chimeric antigen receptor. And these so-called CARs are engineered molecules that, when they are presented on the surface of a T cell, enable it suddenly to recognize foreign invaders it wasn't previously able to identify. And these chimeric antigen receptors can also be engineered in such a way that these cells then become tuned to recognizing solid tumors and other tumors it wasn't previously able to find. And Caribou Biosciences do these types of gene editing modifications on two types of cells, T cells and natural killer cells, using their proprietary technology. And so what is that proprietary technology, you ask? Great question, Sherlock. I got 4 words for you. More precise gene editing. As I had mentioned in the introduction, Caribou Biosciences have a proprietary gene editing technology that is unlike the traditional CRISPR-Cas9 or Cas12. Their gene editing approach is called Chardonnay. No, not that type of Chardonnay, you fool. Chardonnay stands for CRISPR hybrid RNA DNA. The Chardonnay gene editing approach doesn't lend itself only to modifying T cells or natural killer cells, but it can also be applied to induced pluripotent stem cells. Their initial approach is focusing on trying to treat solid cancers using modified T cells. But Caribou Biosciences also emphasize that these types of gene editing approaches can have implications far beyond the mere treatment of cancer as well. But of course, they have to start somewhere. Their most advanced clinical program is the CB-010 program. Their most advanced clinical program is the CRISPR-edited allogeneic anti-CD19 CAR T-cell therapy for relapsed or refractory B-cell non-Hodgkin's lymphoma. And this clinical trial has just recently started in August of 2021. In this, they enroll 50 patients. And this is a non-randomized open-label study. And the estimated study completion date is planned for September of 2025. Okay, so much for the science. In case you would like me to go deeper into their technology from a scientific point of view, please leave me a comment of the video below. If, however, the information I have provided you so far is enough for you to consider a potential investment into the company, let's take a look at the stock and the ticker symbol, which is CRBU. Caribou Biosciences were initially listed on the Nasdaq on July 23rd and had an initial price of $16.32. Now at the beginning of September, that price has gone up and is just shy under $30, which gives it a market capitalization of $1.79 billion. I fully expect that their ongoing, just started clinical phase 1 trial certainly could serve as a catalyst when updates from these activities come out, could have a potential impact, but also, of course, the starting of other clinical trial programs into phase 1 and subsequent phases. Of course, you will have to make up your own mind if this investment is worthwhile and the right type of investment for you. But just consider, for instance, that CRISPR Therapeutics went public on October 21st in 2016 and were listed with a price of $13.82 and have now since then come up to just over 120 US dollars. I hope you found this information useful for your own investment purposes. If you did, please consider liking the video, and if you would like more content, consider subscribing.